So the hypertension in children. Hypertension in children. So firstly, we need to know the definition of hypertension in children. If BP is more than 95th percentile for age and sex, or it's more in child more than 13 years, if blood pressure is more than 130 by 80. So hypertension in children definition, it is of BP more than 95 percentile for age and sex, or if the child is above 13 years, if the blood pressure is more than 130 by 80, it is termed as an hypertension in children. So we have the stages. Stage 1, the BP is between the 95th percentile to 95th percentile plus 12 mmHg. So, or the child, for children above 13 years, the blood pressure is between the 130 by 80 to 139 by 89 mmHg. Next, stage 2. Stage 2 hypertension is defined as if the blood pressure is more than 95th percentile plus 12 mmHg, or if the children above 13 years old, blood pressure is more than 140 by 90, greater than or equal to 140 by 90 mmHg, it is termed as an stage 2 hypertension. So what are the causes for the hypertension in children? So in the adults, the most common cause is the essential hypertension. Whereas in the children, because of this obesities, etc., so essential hypertension is also increasing in children. So, but the most common cause for hypertension in children, it is the secondary hypertension. So secondary to any of the kidney disease, that is due to renal parenchyma scarring, which is seen in the vesicourinary reflex. It is the most common cause. So in the vesical urinary reflex, we have to do the DMSA nuclear scan. We can see the scarring of kidney. So the scarring of the kidney can be seen. And the second one, it is the renovascular problem. Major and minor. So major, it may be the renal artery stenosis or renal vein thrombosis. And the microvascular problem are the HUS. That is the hemolytic uremic syndrome. Next cause, it is the cardiac. That is the coarctation of aorta. Next, it is the endocrine problem. That is the hyperthyroid, Cushing's, pheochromocytoma. So congenital adrenal hyperplasia. In congenital adrenal hyperplasia, we have these 11 beta and 17 alpha hydroxylase deficiency. So other problem, it is the vasculitis. So what are the cause for the transient hypertension in children? Transient hypertensions are caused due to the drugs, and other it is PIGN, that is post infectious glomerulonephritis. Post infectious glomerulonephritis. Next, how to evaluate the hypertension patients. So hypertension evaluation. So first we have to do the echocardiography for the concentric left ventricular hypertrophy. And second, it is the fundus examination for the eyes and the urinary proteins. Because in hypertension, the heart muscle and the eyes and kidneys are involved. So next is the hypertensive emergency. So hypertensive emergency, the definition is stage 2 hypertension that is of more than of 95 percentile plus 12 mm of Hg of the blood pressure, or if the child is more than 13 years old, if the blood pressure it is more than 140 by 90 mmHg, it is termed as a stage 2 hypertension. So along with that stage 2 hypertension plus we need to have the symptoms such as the left ventricular failure, that is in gallop S3, and the basal crepitations, and other symptoms like seizures and the headache. So what is the treatment for the hypertensive emergency? We have to do the IV infusion. IV infusion of sodium nitroprusside or sodium nitroglycerin. And best today now onwards, the children are also giving with the nicardipine infusion in the hypertensive emergency. So the nicardipine is the best. So other options are the IV, esmolol, and labetalol. So one thing about the nitroprusside, sodium nitroprusside, it is sensitive to light. Next, treatment for the hypertension. So the hypertension treatment in children. So firstly, we have to give drug of choice is the AC inhibitors, that is the enalapril. In the ARBs, it is the losartan is the drug of choice for hypertension. So this ACE inhibitors or the ARBs are contraindicated in renal artery stenosis, and also if the GFR is less than 30. So why we are contraindicated in this situation? Because there will be a risk of hyperkalemia with ARBs and ACE inhibitors. So what we should do give in this situation? Give the amlodipine.